Good afternoon. We are live in the back of the Turtle Hospital ambulance. We're here with Nutella, a juvenile green sea turtle with fibropapillomatosis. You can see Nutella has horrific tumors on his eyes. He is otherwise tumor-free, and we are on our way to Dr. Karpinski, the incredible veterinary ophthalmologist that works miracles with these turtles' eyes, and we are hoping for a miracle from Nutella and Thelma. Thelma is another juvenile green sea turtle with fibropapillomatosis. She's had previous eye surgeries, and we are not sure that she has any vision. So please keep your flippers crossed and send prayers and healing energies for Thelma and Nutella, who will soon be arriving at Pinecrest Veterinary Hospital and to have assessments and surgeries with Dr. Karpinski. Stay tuned. We'll come live later today with an update on these beautiful turtles. Thank you for joining us from Kentucky. And we hope everybody's having a happy Friday. Good afternoon. We are live in the back of the Turtle Hospital ambulance. We're here with Nutella, a juvenile green sea turtle with fibropapillomatosis. You can see Nutella has horrific tumors on his eyes. He is otherwise tumor-free, and we are on our way to Dr. Karpinski, the incredible veterinary ophthalmologist that works miracles with these turtles' eyes, and we are hoping for a miracle from Nutella and Thelma. Thelma is another juvenile green sea turtle with fibropapillomatosis. She's had previous eye surgeries, and we are not sure that she has any vision. So please keep your flippers crossed and send prayers and healing energies for Thelma and Nutella, who will soon be arriving at Pinecrest Veterinary Hospital and to have assessments and surgeries with Dr. Karpinski. Stay tuned. We'll come live later today with an update on these beautiful turtles. Thank you for joining us from Kentucky. And we hope everybody's having a happy Friday. Good evening. We are live at the Turtle Hospital in the heart of the Florida Keys. We are in the surgery suite with a brand new patient that was just rescued today. A critical boat strike injury on this juvenile Kemp's, a very young one. We don't usually see this species in our area at this life stage. Very young and critical. She has already gone for a CAT scan at the human hospital. She has gone non-responsive, but is currently on life support and showing very good signs. Right now we have Taylor, and she is getting a heart rate with the Doppler. If you listen very closely, you can hear that. I'm going to come close so you can hear. So that is her heart rate, which is much better. It was just one heartbeat every 2 minutes. And now what are we up to, Diego?
About 32.
About 32 beats per minute. So she is on O2, but she is responsive. She's resting at the moment. And her name is Rhiannon. I think I'm saying that right.
I think so.
I keep wanting to say Rihanna, but it's Rhiannon. And she was rescued in Big Pine. That is the Lower Keys. Hello from Marietta, Georgia. Thank you for joining us. But it's been a pretty intense evening here at the Turtle Hospital. This extremely dedicated team has been spending their Saturday night keeping this little one alive. And I'm going to come close up. You might want to look away if you don't want to see the boat strike injury, but we have already stabilized that shell. elevated it. That shell was down into the lung, and that is an orthopedic plate. They were donated to the Turtle Hospital. I am going to give a shout out if there are any orthopedic surgeons out there and you have orthopedic plates you want to donate to the Turtle Hospital. We are looking for small orthopedic plates. We do use them. They do an incredible job when we have to elevate a shell like this and leave space for that lung. Her lung was breached, but we have had turtles heal well from a compromised lung. She's a young, healthy turtle before she was hit. Thank you for joining us from Ohio. Thank you for the prayers. Now you're going to see them tipping her, and that is because that trach tube is getting blood and fluid in it from the lungs, and we want to make sure she has a clear airway. And you can see she gets very active now when we work with her. And she literally went non-responsive, and we thought we lost her, but we looked at the CAT scan, and her spinal column, there she goes. Her spinal column is intact, and I will share the CAT scan and before and after pictures of her shell, but her spine, where all the nerve endings are, is intact. If it wasn't, we would not have resuscitated her, just for your information, because a damaged spinal column means neurological challenges that we can't compete with. But because her spinal column was intact, we intubated her and resuscitated her, and she is responding very well to that, as you can see. Thank you for joining us from Cape Coral and from Amherst, Virginia. Thank you for joining us. And she is feisty, so we need a lot of prayers and healing energies and strength for this team that is going to be working through the night with her on life support. My guess is she will probably be extubated through the night. She is starting to take some breaths on her own already, which is a wonderful sign. And she is still critical, and what that means is it's going to depend on her immune system. We're going to, once she's stable, start her on some broad spectrum antibiotics. She's already had fluid treatment and is going to take a lot of supportive care. We know it's a long shot, but this little one so far is showing some very positive signs despite her very critical injury. Thank you for joining us from Eaton, Ohio. And more good prayers and energy from Ohio. Thank you. Hello, Mexico City. Thank you for joining us. Christina, thank you for the prayers, and thank you for the love from Iowa. Karen, this is a juvenile Kemp's-Ridley sea turtle. It was rescued today in the Florida Keys late in the day from a severe boat strike. Thank you for joining us from Rhode Island and for the prayers. And we will give you an update tomorrow. I just want to mention our eye surgery patients from yesterday. They recovered from anesthesia and from surgery well. We are still concerned about Thelma. She has started chemotherapy, eye drops, but we are not sure how visual she is. So that is still a critical patient, and only time will tell with the treatment. So there is an update on Thelma. And Nutella has clear cornea on both sides. So thank you for following along. Hello in Sugarloaf, our neighbors. Thank you for joining us. Hello in Oklahoma and North Carolina. Thank you for the prayers from Kentucky. And have a pleasant evening.